everyone, today I am giving you information on the topic blindness. This one is the blindness part 15, in which I'll explain you about the role of eye checkup camps in the prevention of blindness. Okay, so the basic of the blindness comes to the eye checkup. First of all, the eye checkup is very important so that we will get to know that what is the ocular condition of the patient. According to the condition, we will treat it. Okay, so as we will do the treatment on the time, then we will prevent the blindness. Let's move to the first one, role of eye camps in the prevention of blindness. Okay, so eye camp approach for the prevention of blindness still plays a vital role in the developing countries where the infrastructure is not fully established. So eye checkup camp plays a very important role in the prevention of blindness in the developing countries where we don't have the proper infrastructure. Okay, so it is particularly more relevant keeping in the view in fact that there is still 62.6% of the blindness in India is due to the cataract, which can be very well cured in eye camps. Okay, so it is seen that 62.6% of the blindness is in India, which is just due to the cataract, because the people do not have the proper facilities, proper money, proper infrastructure, proper things, so that they will move to the eye hospital and do their proper treatment. So according to the eye checkup camps, by doing the eye checkup camps, we will reach at that site where we will find out those patients who have the cataract and do their cataract surgery at the proper time. We'll select those patients, collect those patients, and move them to the hospital for their eye surgeries, for sometimes for the free and sometimes in very less cost, so that there will be a prevention of blindness in our country. Okay, so in this way, basically the eye checkup camps plays a very important role in the prevention of blindness. Next one is organization of camps. There are the two types of camps. First one is the comprehensive eye care camps with reach out approach, and the second one are the screening eye camps which are reach in approach. So let's see comprehensive eye care camps. Now the comprehensive eye care camps have different phases. First one is the preparatory phase, second one is the intensive phase, third one is consolidation phase, fourth one is cumulation phase and retrieval phase, and the fifth one is the follow-up phase. So let's see one by one. First one is the preparatory phase. In the preparatory phase, we will just do the preparation of the camp. Okay, it is the most important for the successful organization of an eye camp. So it is very important so that we will successfully organize the eye camp. It includes the different activities. First one is the finalization of organizers and the medical team. We will finalize those who are the organizers and the proper medical team which are going to do the eye camp. Second one is the permission to hold eye camp. Okay, take the permission that we are going to hold an eye camp. Next one is selection of campsite, where we have to select the site of the camp. Okay, where we will do the camp so that we will find more and more patients for the cataract surgery. Okay, more and more area will be covered, more and more patients will be covered, and this one is the selection of the campsite. Next one, publicity and mobilization of community resources. We'll do the publicity regarding this, that we are going to do the eye checkup camps, so the more and more public will be there. It will be done through the newspapers, radio announcements and the different things by which we will collect the public. Okay, next one are the other activities. Next one is the finalization of organizers and the medical team. Okay, so presently most of the eye camps are planned and coordination by the DBCS. Okay, mostly eye camps are planned. Okay, and some of them are done by the coordination of the DBCS. Usually the organizers are voluntary organizers of repute. The medical is either from the district mobile ophthalmic units or the charitable hospitals or the state mobile ophthalmic units. Okay, so medical equipments are provided by the mobile ophthalmic units or the charitable hospital. Sometimes it may be set up at the charitable hospital, sometimes the mobile units are there. Okay, so this one is the mobile unit, this one is the van, and this one is the setup which is inside the van. Okay, so slit lamp is there, basic refraction unit is there, and NCT, AR, all these machines are set up inside this van so that they will select the patients. This one is the mobile ophthalmic unit. Okay, so this kind of setup may be there, and sometime the eye checkup camp should be done at the hospital or at by doing this kind of setup at a proper place. Next one, permission to hold eye camp. Now permission is sought by the organizers from the CMO or the civil surgeon of the district. So By taking the permission, we will hold the eye camp. Next one is the selection of campsite. The camp should be preferably be held at the charitable hospital. Okay, so the site should be at the charitable hospital so that the available operation theatre facilities can be used. Okay, uh, charitable hospital will be the best because it will be cost effective, also cost friendly with the patient, as well as proper facilities like operation theatre will be there, which we will not give at the mobile ophthalmic units. Okay, publicity and mobilization of community resources. So it is the most important aspect for the success of an eye camp. If we have to make our eye camp a success, so publicity is very important. Publicity should be started at least fortnight prior to the actual camp date. Okay, so publicity should be start a lot before the camp date. Okay, method of publicity should be include the public announcement. We'll do the public announcements, radio broadcast, and the display of banners and poster at the prominent places like the bus stand, railway station, and schools. Okay, so according to this, if the eye checkup will be free, then more and more people will become. Okay, so properly announcements or the publicity should be done, so more and more people will come and take the benefit of that thing. Next one is other activities. Now, what are the other activities? This include the arrangement of medicines and the food for the patient, stay arrangement for the medical team, and the mobilization of volunteers and the social workers for rendering assistance to the eye team. So, what we can do for the other activities, as the doctors are playing a very important role in the prevention of blindness, so there should be the proper arrangement of the medicines which we will give to the patients. Okay, these are arranged by the doctors or the political parties a lot of times, and the food for the patients as well as doctors, stay arrangement for the medical team where the medical team have to stay, their staying arrangement should be there, and the mobilization of volunteers, proper volunteers should be provided, and the social workers are provided so that they will handle all these things. Okay, next one is intensive phase. Now eye camp should be at least should last 7 days, out of which 2-3 days should be set apart of the intensive phase. Okay, there is a 7 days camp in which we will do the checkup of the patients, we will do the surgeries of the patient, we will collect the patient. So all these things include the 7 days, during which of the following activities need to be performed. Now, in 7 days, what activities to be performed? The medical team comprising at least one resident doctor, 2 nurses, 2 operation theatre assistant, and 2 paramedical personnel should reach the campsite at the evening before scheduled commencement of the camp. They should set up the OPD ward and the operation theatre. OT room should be fumigated with the formalin vapors and the kept closed overnight. Okay, so 2 teams should be made. First one is the OPD team and the second one is the OT team. Okay, so the medical team both combined, then we do the both combined, then it consists of the medical team. So it consists of 1 resident doctor, 2 nurses, 2 operation theatre assistant, 2 paramedical personnel which are the OPD. Okay, OPD side should be reached at the campsite even one evening before. Okay, they will come to the campsite one evening before. They should set up the OPD ward and the operation theatre. Will set up, do all these things. The OT room should be fumigated with the formalin vapors and kept closely overnight. Okay, so this should be done. Proper setup should be done from their side so that they will get the estimate of how many patients are coming from the camp. Patients are provided comprehensive eye care services including the refraction. So proper refraction of the patient should be done, dilated as well as undilated. Their IOL power should be calculated. Their blood test should be done. These requiring surgical intervention for the cataract and the other diseases are admitted in the ward. Okay, so if they need any other, if they have any other diseases rather than the cataract, they are admitted in the ward. Proper their diabetes should be checked, their blood pressure should be checked. So if they have the complications or the surgeon feels that there are complications in the surgery, they may be admitted in the ward or their surgery may be cancelled due to these things. Next one, guidelines. Now, for performing ophthalmic surgery, following guidelines laid down by the government of India should be added to. Okay, so some are the we have the guidelines which are provided by the government of the India. So first one is at least one anesthetist with the arrangement to meet common emergency should be available. At least one anesthetist, those person which give anesthesia to the patient at the time of the surgery, should be available. Okay, at least one, preferably 2 operating surgeons should be there, and each surgeon should not perform more than 30 operations in a day. Okay, so while doing the eye camps, we are doing comprehensive eye camps, 2 operating surgeons should be there, and first surgeon will not perform more than 30 operations in a single day. This is the guideline which is given by the government. So presently extracapsular cataract extraction by any technique, preferably manual, small incision cataract surgery, or the phacoemulsification with the posterior chamber intraocular lens implantation is recommended method. Okay, so these methods are used. Presently ECC, extracapsular cataract extraction by any method is done. Mostly SICS, small incision cataract surgery is done, or sometimes phacoemulsification is done. Mostly SICS is done. Okay, ideally the number of operations per day should not exceed 50 in a camp and should not exceed 200 to maintain the quality and the safety of sterilization, surgery and the post-operative care. So ideally number of operations per day will not exceed after 50 in the camp and should not exceed 200. Okay, so they will not more than 200 and should not less than 50. Okay, should not exceed 50 or should not exceed 200 in a camp, so that we will maintain the quality as well as the safety of the sterilization, surgery and the post-operative care in order to prevent infection, in order to take the proper in order to be maintain the quality as well as the safety. So this limit should not be crossed. Both the eyes should never be done operated at a single time. Okay, so one eye may be operated at the one time and the second eye may be operated after the 20 to 30 days when one eye get properly settled. Okay, both eyes should never be operated at a single time while doing the cataract surgery. Next one is cases with poor surgical risk such as severe diabetes, severe hypertensive, and those having cardiac problems should not be operated in the camps. Those patients who have these severe problems, severe poor surgical risk such as severe diabetes should be under control, which is not more than 200. Okay, 200 is considerable, but if it is more than 200, so it will not be considerable, and though that person should not be done the cataract surgery under the eye camps. Proper intervention may be needed. Okay, severe hypertension, those who have a high blood pressure while doing the cataract surgery will not be treated, and those having cardiac problems, those who are related with the heart problems, heart surgeries are done. Those who seems to be complicated patients should be kept aside. Okay, so these cases associated with these problems like this should be referred to the base hospital. So they should be referred to the base hospital. For example, if a person has the severe diabetes, so first of all he or she is supposed to control the diabetes, supposed to control the hypertension if have, then we'll do the cataract surgery. Okay, so they may be referred to the base hospital or the general hospitals. Along with the curative and the preventive services, the eye health education is carried out simultaneously. Okay, so eye health education is properly provided and the preventive services are provided. So these are provided simultaneously. Proper method of prevention should be given to the patient, and proper eye health education is provided to the patient simultaneously. This was the end. Thanks for your patience listening.